Hello, this is Dr. Ron Valdiserri reporting from the 2015 National Summit on HCV and HIV. And I'm very happy to be joined by my colleague, Dr. Mermin, who heads up CDC's Center for HIV, STD, tuberculosis, and viral hepatitis. So welcome, Jono.
It's great to be here, Ron.
Great. I wonder if you could talk a bit about the overlap with the prescription opioid drug abuse epidemic in the United States, because you know very well about that, but that really hasn't come up yet, and I think that's an important dimension here.
It is. This is the tip of an iceberg. There's a large epidemic of misuse of prescription opioids. Medication that is usually prescribed to people to take orally
for pain,
but also can lead to addiction. And a small proportion of those people who misuse those medications end up becoming addicted and then injecting drugs, either heroin or these drugs
Sometimes
themselves.
The drugs themselves.
In addition, these drugs that are usually orally taken often have an effect that is short-lived. So in the outbreak that we were discussing in Indiana, people are injecting more than 5 times per day among a large group of people who they're sharing needles. So that led to very rapid transmission of HIV in the community. We have not yet seen that kind of rapid incidence of HIV in a drug-using community ever before documented in Indiana.
So I guess one of the messages also, and you referred to this, is that our focus is on this particular geographic area in one state, but there could be situations like this that might be brewing elsewhere, correct?
Exactly. And the way to use outbreaks is not just to control the outbreak itself, but to reflect on it and say, what do I need to do differently elsewhere in the nation? So one thing that we can do is recognize that the prescription drug opioid epidemic is occurring in rural America, outside of the communities that often are informed about not sharing needles and how to protect themselves from HIV and hepatitis C. So they're often not informed and end up getting infected with these viruses. So our job is to get information out. Our job is to also look at what kind of situations could put communities at risk for this particular situation, and to prevent the events that occurred in Indiana from occurring elsewhere.
And is it not true that between 2010 and 2013, CDC has reported over 150% increase in reported cases of acute hepatitis C infection?
That's correct. We've seen a dramatic increase in the incidence of hepatitis C in the United States, and we've tied it through correlations to places where there's been an increase in prescription drug opioid misuse and subsequent injection drug use. So there's a path that is occurring in the United States that is leading to increased hepatitis C and ultimately to poor health for many Americans.
Great. Well, we really appreciate the great work that your center and other parts of CDC are doing to address this outbreak and the bigger issues associated with HIV prevention and prevention of hepatitis C. Keep up the good work, Jono.
Well, thank you, Ron, and thanks for your leadership at HHS.
Great. This is Ron Valdiserri reporting from 2015 National Summit on HCV and HIV.